What is the average cost?
Well, it really varies depending on the practitioner and their experience and where they are, of course. I would say that the treatments probably range from $70 to $90 or $100 an hour, depending on who the practitioner is.
And if I wanted to become a therapist, what sort of training is required?
Well, the training program is available for licensed health care practitioners. And it's a 6-step process where there are workshops where you learn techniques, and then you practice them on patients until you get really skilled at that level of work, and then you go on and study more. We train practitioners throughout Canada and the United States, and we have chiropractors, physiotherapists, massage therapists, all taking the training. We have dentists taking it for the TMJ, which is jaw pain. We have some psychotherapists and psychologists taking the training for the emotional release part of the work, which is also another aspect of the work. And we have some medical doctors who take it just for their own understanding, and certainly ones who want to do hands-on work. So it really, you need to be a healthcare practitioner, and then the classes are available.
Great. And if I was looking for a qualified therapist in my area, is there an association I can call, or?
Well, it's probably best to call the Craniotherapy Center, and we have a book of all of the practitioners in North America and how many levels of training they've had. And so what we often do is have people calling and asking us who do we know that works with children in such and such a place, and we can give them that information.
I understand you have a couple of volunteers standing by for a demonstration?
We do. We have 2 of our clients are here today.
So you don't mind demonstrating some
Absolutely
techniques?
not. I'd like
Great.
to.
Okay, we'll be right back. We're here in Alix's treatment room at the center, and joining us is Lee, who will be volunteering for us today. Welcome, Lee.
Hi.
I understand this isn't your first time here at the center.
No, it's not. Well, the first time I heard about craniosacral was through my sister. Her husband has been suffering from TMJ for years, and
what is that exactly?
It's mandibular. What is it?
Pain in the temporomandibular joint. It's the jaw pain.
Jaw pain, which a lot of people suffer from. And he'd had this chronic pain for years, and nobody could help him, and he was going to have surgery. So he came here and was helped, and he doesn't have that condition anymore. So she sent her son, who had been suffering from migraines, and now he's fine. So then she heard about that they also treated children with attention disorders and hyperactivity, and she thought of me immediately because I have a son who is 7 and was quite a handful until I brought him here. And this was a kid who was bouncing off the walls and in fights all the time at school, and would never go to bed at night. I brought him in here, and within 10 minutes he was asleep on the table. It was just amazing. And since then, he's just really calmed down, and he's much happier. And then my daughter came with chronic neck pain, and I was the last in line. I thought, I'll get everybody else done first. Then I came with my chronic neck pain, which I'd suffered for years with, and I'd been going to the chiropractor, and nothing was helping. It was always coming back, and I came in 1 treatment. It was done, and I've been so impressed with it that I studied up on it, and I've taken the first level course in craniosacral myself.
So your understanding is greater.
I just think it's fantastic.
Great. Well, Alix, if Lee was a first-time client, how would you initially assess her?
Well, after I've taken her medical history, what I would do is I would palpate her cranial rhythm on different parts of her body, and I would feel as the body expands and comes back in a very minute way, where the areas of restriction were. And with Lee, actually, what was going on with her neck pain was that her hips were out of alignment. And one was torqued high and one was torqued low, which of course puts a strain through the whole system and will manifest in the neck and head.
Sure.
And so I would feel this, and initially Lee's hips were almost torquing in that kind of direction rather than this kind of direction. And then I would move up through her body, palpating the areas that were restricted and paying particular attention to her intracranial membrane system, which is the system, of course, that surrounds the whole brain and cord. And what I would do is feel for the areas that were restricted and treat them. Now, sometimes people who have chronic neck pain, they often have problems right up at the very top of their neck. And this is a place that in whiplash, when people have whiplash symptoms that go on for a very long time, this area, it's the place where the first vertebrae articulates with the base of the skull. And the technique is a very gentle technique to allow her system to mobilize this area. I just support it in such a way that it can become free. And as that does, it allows proper blood flow into the head. This is a place a lot of headaches come from, a lot of neck pain. It's the place that for infants with colic, often it's a problem. But of course, if you've got restrictions in the neck, you're going to have restrictions all the way down through the body and into the spine. And so with Lee, what I would do today is I would want to work a little bit on this occiput back here. Now her bones move well, but the membrane system inside has still got some restriction in it. So I would follow gently the way her body moves. And if I wanted to treat her neck and head together, I would just follow the way her inherent body tensions are holding her.
Right.
And that would be the first position that her body lets me know is the position it needs to release. So rather than treating just one area, I can now treat her whole head and neck. I could do the same by treating right down through her whole system. When people come in with frozen shoulder or shoulder problems, it's the same process that I would be able to pick up the arm, feel for the inherent pulls within the system, and it would show me the position it would need to hold in order for that force to go out. And then when that force goes out, that particular part of the system releases. So for everybody it's different, and for every treatment it's different. But the principles are always the same. Very, very gentle forces so that she doesn't need to defend herself. Following the way her system needs to release. And our theory is that our patients' bodies are always wiser than we'll ever be in how they need to release. And if we can just learn to listen and follow and support them in their release process, then we have a very effective therapeutic response.
Are there any simple techniques one can take at home?
Actually, there are. If you would just hand me those two balls and a sock. This is somebody has developed this technique to induce still points. And what this is, it gives your system a mini cranial treatment. And so what I would do is I would advise the person to take two, these are just foam balls, or tennis balls will work, or squash balls, in a sock, put them in a soccer stocking and tie them tight together so they can't come apart. And then if they draw a line from the top of their ear to the back of their head where it sticks out the most, they would just lie on these balls for 10 minutes a day. And what that does is it sort of tricks the cranial system into going into what we call still points. And every time she's in a still point, it starts that self-correcting mechanism. So tight areas will release, cranial problems will correct, but most importantly, her nervous system will go into the deeply relaxed state that's so important for healing.
And I got one for everyone in my family.
Oh, that's great.